Welcome back. Today we're tackling a crucial topic: 10 pain relievers seniors should avoid using daily. As we age, our bodies change. Slower metabolism, less efficient kidneys and liver, and increased medication sensitivity. Some common pain relievers can actually do more harm than good for seniors, leading to risks like internal bleeding, kidney damage, heart problems, and confusion. This video is for educational purposes only. Always consult your healthcare provider before making any medication changes. Your doctor knows your health history and can guide you safely. Let's dive into the list and help you make informed choices. Ready? Let's get started. First up is aspirin, a household name for over a century. Many people reach for it without a second thought, trusting its familiar label and long history. But while aspirin is often seen as a simple solution for headaches or minor aches, its effects on the body are far from simple, especially as we age. While low-dose aspirin may be prescribed for heart protection, daily use of higher doses for pain is risky for seniors. The body's ability to process medications changes with age, and what was once safe can become dangerous over time. Many older adults may not realize that the risks of regular aspirin use can quietly build up. Aspirin reduces protective compounds in your stomach, increasing the risk of ulcers and dangerous GI bleeding. Even a small daily dose can gradually wear down the stomach's natural defenses, leaving it vulnerable to irritation and injury. For older adults, a GI bleed can be life-threatening and symptoms may be subtle. You might not notice anything until the situation becomes serious, and by then, treatment can be more complicated. The blood-thinning effect of aspirin only worsens this risk. It makes it harder for your body to stop bleeding, even from minor injuries or internal sources you can't see. Healing is slower with age, making complications more severe. A simple cut or bruise can take much longer to heal, and infections or other problems can develop more easily. Unless your doctor specifically prescribes it for heart health, daily aspirin for pain isn't worth the risk. It's important to remember that what works for one person may not be safe for another, especially in older age. There are safer alternatives for chronic pain. Options like physical therapy, gentle exercise, or even heat packs can help manage discomfort without the same risks. Always discuss your options with your doctor. They can help you weigh the benefits and risks and find a pain management plan that's right for your unique health needs. For seniors, the risks of daily aspirin often outweigh the benefits. Taking the time to understand your medications and their effects can help you stay healthier and avoid preventable complications as you age. Next up is ibuprofen, a medication many people reach for when they have aches and pains. You might know it by its brand names like Advil or Motrin, and it's found in almost every household medicine cabinet. While it's very effective for relieving short-term pain, such as headaches, muscle aches, or arthritis flare-ups, using it every day, especially for seniors, can be risky. Ibuprofen works by reducing inflammation, but it also decreases blood flow to the kidneys. Over time, this can speed up kidney decline, particularly in people who already have conditions like diabetes or high blood pressure. Another concern is that ibuprofen can cause your body to retain extra fluid and make your blood vessels tighten, which raises blood pressure. For people who already struggle with high blood pressure, this makes it even harder to keep it under control, and it increases the risk of serious problems like heart attack or stroke. What's especially concerning is that kidney damage from ibuprofen often happens silently, without any warning signs, until the problem becomes severe. That's why, if you find yourself needing pain relief often, it's important to have regular checkups and blood tests to monitor your kidney function and blood pressure. Ibuprofen should really be reserved for occasional use, not as a daily solution for chronic pain. If you need long-term pain management, talk to your doctor or pharmacist about safer alternatives that won't put your kidneys or heart at risk. Don't let a common painkiller quietly damage your health. Be proactive and protect your kidneys and blood pressure for the long run. Number 3 is naproxen, or Aleve. Its long-lasting effect means longer exposure to risks, especially for the heart and stomach. Naproxen increases the risk of heart attack and stroke, particularly in seniors with existing heart issues. It's also harsh on the stomach, raising the chance of ulcers and GI bleeding. For chronic pain, the cumulative risk is substantial. Occasional use for short-term pain is different, but daily use is dangerous. Always weigh the risks and benefits with your doctor. For most seniors, daily naproxen isn't worth the double whammy. Number 4 is acetaminophen, Tylenol. It's often seen as safer, but daily use can quietly damage the liver, especially in seniors. The liver processes acetaminophen, and too much can cause liver failure. Seniors should stick to lower daily limits, often under 3,000 mg. Acetaminophen hides in many combination products, making accidental overdose easy. Always check labels and ask your pharmacist for help. Early liver damage symptoms are vague, so prevention is key. Even safe medications need respect and careful dosing. Use acetaminophen under medical guidance, especially for daily use. Now let's talk about codeine, often combined with acetaminophen. It's prescribed for moderate pain, but is risky for daily use in seniors. Codeine can cause confusion, sedation, and dizziness, dramatically increasing fall risk. Falls in seniors can lead to fractures, head injuries, and loss of independence. Constipation is another major issue, often severe in older adults. Some people don't metabolize codeine well, getting side effects without pain relief. Because of these risks, codeine is on the Beers criteria, a list of drugs to avoid in seniors. The risks usually outweigh the benefits for daily pain management. Safer alternatives are available. Always consult your doctor before using codeine regularly. Next is tramadol, once thought to be a safer opioid. It still causes dizziness, confusion, and a high risk of falls in seniors. Tramadol can interact dangerously with antidepressants, leading to serotonin syndrome. Dependency and withdrawal are real risks, even with daily use. Its pain relief is unreliable, especially for those who metabolize it poorly. The risks, falls, confusion, dependency, make it a poor choice for chronic pain in older adults. Doctors are increasingly cautious about prescribing it. If you're on tramadol, discuss alternatives with your healthcare provider. Don't gamble with your safety for daily pain relief. Number 7 is celecoxib, or Celebrex, a COX-2 inhibitor. It was designed to be gentler on the stomach, but it increases the risk of heart attack and stroke. This risk is especially high for seniors with heart disease or stroke history. Even without known heart issues, the risk is higher than with no medication. Celecoxib should only be used after careful discussion with your doctor. For many seniors, the cardiovascular risk outweighs the benefit. It's a reminder that even smarter drugs can have serious downsides. Always review your personal risk profile before starting celecoxib. Safer pain management options are available. At number 8 is indomethacin, a potent NSAID. It's effective for severe inflammation but notorious for causing confusion, delirium, and even psychosis in seniors. These side effects can mimic dementia or stroke, leading to unnecessary worry and hospitalizations. Indomethacin also carries all the usual NSAID risks: GI bleeding, kidney problems, and heart issues. It's featured on the Beers criteria as a drug to avoid in older adults. Rarely justified for daily use, it's best reserved for very short-term treatment. Discuss alternatives with your doctor if indomethacin is suggested. The risk to brain health is simply too high. Number 9 is diclofenac, found in pills, gels, and patches. The oral form carries one of the highest risks for heart attack and stroke among NSAIDs. It also increases the risk of GI bleeding and liver damage. Many health organizations recommend against its use for daily pain relief in seniors. The topical gel is safer, but the pill form is especially risky. If you're taking oral diclofenac, talk to your doctor about safer alternatives. The triple threat, heart, GI, and liver risks, makes it a poor choice for long-term use. Not all NSAIDs are created equal. Choose wisely. Number 10 on our list is oxycodone, a high-potency opioid medication commonly prescribed for severe pain, such as after surgery or for advanced illnesses. While it can provide significant relief when used appropriately, oxycodone is not without serious risks, especially for older adults. In seniors, oxycodone can cause extreme side effects, including dangerous respiratory depression, profound sedation, and mental confusion. These reactions are more pronounced in older bodies, which process medications differently and are more sensitive to their effects. Such side effects can quickly escalate, leading to potentially fatal breathing problems, increased risk of falls, and a devastating loss of independence. Even a small miscalculation in dosage can have life-altering consequences. Oxycodone is also highly addictive. Seniors can develop a rapid tolerance, meaning they need higher and higher doses to achieve the same pain relief, which increases the risk of overdose and dependency. The margin between effective pain relief and dangerous overdose is alarmingly narrow, making careful monitoring essential. The ongoing opioid crisis in our communities is a stark reminder of the dangers associated with daily opioid use for chronic pain, especially among vulnerable populations like seniors. For most older adults, taking oxycodone every day can lead to more harm than good, often resulting in a decline in overall health and well-being. That's why oxycodone should only be considered as a last resort, reserved for cases of severe, short-term pain where other options have failed, such as immediately after surgery or during end-of-life care. The ultimate goal of pain management is to enhance quality of life, allowing seniors to remain active, engaged, and independent, not to diminish their ability to enjoy daily activities. Always talk openly with your doctor about safer pain management strategies and explore non-opioid alternatives whenever possible to protect your health and independence. That was a lot to take in, but knowledge is power. Understanding medication risks helps you make safer choices and partner with your healthcare team. Never start or stop medications without consulting your doctor. Share this video to help others stay informed and safe. We're all in this together. Let's look out for each other. Thanks for watching and investing in your health. Stay safe, stay informed, and see you next time.